Hi there, Dr. Leslie Masters talking more about metabolic medicine. You know, I've spent the last 3 years at the University of Southern Florida as a student getting my master's degree in metabolic and nutritional medicine. I was astounded to realize that I'd gone to 5 years of medical school, 10 years of post-medical school training. I did not learn this stuff. It's taken a master's degree from a medical school focused on metabolic and nutritional medicine to help me understand how important all this stuff is. With all the classes that I took over the last 3 years, one of the big consistent themes from experts in this field from all over the world has been this: you start with the gut. I say that to patients when they come in and they're ready to start a journey in metabolic medicine, and just the excitement goes out of their face. Start with the gut. Well, no, I'm here because I'm anxious, I'm depressed, I'm down, I run out of energy, I don't sleep, those sort of things. Or weight loss, metabolism, energy. But the truth of the matter is, it's all interconnected, and we start with the gut. And I can help make that easier to understand by giving you a few questions. And these are what I call my did you know questions. Did you know that 70% of your serotonin is made in the gut? Serotonin is the neurotransmitter that we're all familiar with. It's what we use. We want increased levels of serotonin and we have less depression. The drugs that modern medicine give us act on the brain, the neurotransmitters in the brain, and stimulate the receptors to absorb more serotonin and help us feel less depressed. 90% of people with irritable bowel syndrome are depressed. Well, they should be. Their gut's not working. They're not making serotonin. But we don't treat the gut. We treat the symptoms in the brain and don't fix the original problem. That's what metabolic medicine will focus on doing. And that's why it matters that we start with the gut, that we fix it in a very systematic, methodical way. A lot of patients, if they're not interested in depression, sleeplessness, those sort of things, will be interested in weight loss. That's a biggie. People come in and say, energy and my weight. If I can just fix those two things, then the world will be grand. We start with the gut. Did you know that you have over 100 times more DNA in your body from the bacteria lining the GI tract than you do your own DNA? 100 times more. That bacteria acts like a separate organ, and it's essential. Did you know you get more metabolic activity out of the bacteria in your GI tract than you do from your own liver? Did you know that scientists have now identified a bacteria in the GI tract that they call the fat bugs? These are unhealthy bacteria in the GI tract. Get this, they actually absorb more calories from your food than healthy bacteria. And we wonder why we're overweight. It is not a one-size-fits-all solution. Weight loss and energy really are a multifactorial problem, but the fat bugs may have something to do with it. The big question we should be asking ourselves when it comes to weight loss is, well, when I take in food, what's my body doing with it? We know that we can take in carbs. So that's the standard American diet right now. We take in carbs, carb will get into the cell, get into the mitochondria, go through the citric acid cycle, and boom, it spits out 6 ATP. ATP is cellular energy. From every molecule of glucose or carb, I will get 6 ATP. Well, let's back up. What if I take in fat, a fatty acid? It needs a lot of cofactors, about 21 cofactors to get into the cell, into the mitochondria, goes through something we call beta oxidation. But one molecule of fat will spit out 28 ATP. I get 5 times the energy from fat. The clincher here is this: we don't have all of the cofactors. Many of us are missing the vitamins, nutrients, cofactors we need to adequately metabolize fat. What does a postmenopausal grandma and a star athlete have in common? They can't metabolize fat. When we're dealing with the star athlete, we call it overtraining syndrome. They work out so hard, burn so many calories, they can't take in enough carbs to burn those calories. They want to burn fat, their body wants to burn fat, but missing one of these cofactors to help you metabolize fat will make them do just the opposite of what they want to do. They work out for 3 hours and they break down muscle. That's called overtraining syndrome. They become catabolic in working out too hard rather than anabolic, building muscle. A postmenopausal woman, they will tell you time and again, and they are not kidding. I know. You can't lose weight. Postmenopausal women have the most difficult time losing weight. It's the same reason, but just a different clinical appearance. We don't have the cofactors we need to mobilize fat and use fat for energy. So what do our bodies do? They crave carbs. We get into this carb cycle. Carbs give me energy, carbs make me feel good, and we start burning carbs. And it makes it really difficult to switch from the standard American diet to a low carb, a Mediterranean, a caveman way of eating. We get stuck on these high carb diets. It's difficult to lose weight if we don't simply have cofactors. I can't tell you how many patients that I've worked up, it's one amino acid that's missing. It's one vitamin that's missing, and we can get this straightened around. A lot of times when I start talking about the bacterial flora in the GI tract and fat bugs and healthy bugs and overgrowth of yeast or different things that can happen in the GI tract, I get a look on people's face and it's this aha moment. Oh, I know what I should do. I'll eat more yogurt and I'll take probiotics. That's wonderful. It's just not that simple. What we really have to do when we don't have a healthy GI tract to start with, we need to remove what's wrong. We need to repair the lining of the GI tract. We need to replace the nutrients that are missing. And then we re-inoculate the GI tract with healthy bacteria that will absorb our nutrients, that will give us the energy that we need. Things that happen when our GI tract is not healthy are these. We don't absorb the nutrients we need to make digestive enzymes, so we don't digest food, or the nutrients we need to absorb the food we eat for nutrition, so we don't absorb the food. Worse yet, we get an overgrowth in bacteria, and they absorb our nutrients. We get the calories, they get the nutrients. There's something called leaky gut syndrome, where we leak a lot of our nutrients into the gut and just excrete it before our bodies ever get to use it. There's something called dysbiosis. Dysbiosis is not too much bacteria, just the wrong kind of bacteria. And then there's the biggie, which is yeast overgrowth. Yeast feed on sugar. The only thing they will eat for energy is sugar. So when we start craving carbs and we can't figure out why we can't get off carbs, it's likely because your GI tract is lined with Candida or yeast, and that's all they want. And so we crave carbs and we get into this vicious cycle. A way to get out of that cycle is repair the GI tract. And whether we're talking about weight loss and food and energy, or we're talking depression, anxiety, sleeplessness, neurotransmitters, detoxification, energy, weight loss, it's all got to start with the gut. I hope you'll join us in some upcoming videos. I'm going to talk more about something that's got a lot to do with weight loss and energy production, and that's detox. It's the favorite topic out there right now is detoxification. I want to give you some more did you know questions about detox.